Hi, Rebecca Rainbird. We're just back and we're talking about modifying our clients' exercise requirements for special populations. So clients that may have a lower back problem, a knee problem, or perhaps blood pressure. So some of the things that I've looked at would be blood pressure. So ideally your average blood pressure would be 120/80. So somebody that has abnormal blood pressure or hypertension, we need to monitor their exercise program. So looking at the program that we just partook in, some of the things that we would need to modify in those areas with high blood pressure. First and foremost, it's important to listen to your body. So just remind your client that if they're feeling unwell, just to let you know that they may need to take a little bit of time out, especially if they haven't been exercising before. If they're very new to exercise, I would be just looking at their cardio for 10 to 20 minutes one a day and increase it from there, and perhaps be looking at that 3 times a week, okay? If they've been exercising for a little bit more than that and they're able to handle a little bit more, you could be looking at that 3 to 5 days, okay? So looking at the program that we just done, some of the modifications that I would make, reduce the weight, so take the weight out of it if you wanted to, and just go back to body resistance weight. Otherwise, reduce the weight or use your pin-loaded machines. You'll have more control over that, and your client will actually gain a little bit of confidence while they're lifting that weight as well, which will be a good thing. If they're medicated, just be very mindful about their medication, and if they wear a heart rate strap too, that's a great way to monitor their numbers and just make sure they are within that healthy range of heart rates there. Okay, so the next item that I'll talk about will be the lower back. So if your client is presenting with lower back strained muscles there, so we're just going to say our client has strained lower back and external obliques. So she's commented on it after advising after the last training session, and obviously I've advised her to see her physio. So she's gone and seen her physio. She's mentioned it, as I said. We've monitored her range of motion and her flexibility, which I've noticed to be quite restricted. So we just need to look at that. So range of motion and a lack of confidence as the client feels that the muscle group is really pulling and she doesn't want to tear those muscles. We've altered her program to include more stretching. This will increase her range of motion and it'll also increase her flexibility, which in turn will gain her more confidence. I'd also consider, if it's available and you have the facilities, aqua aerobics. So really good, takes out the whole weight of the body, so it'll release that pressure from the obliques, the lower back, okay? So if you have the facilities there, I actually would highly recommend that. If the pain persists, I would also advise rest, okay? So there could be swelling within the muscles there. So if pain persists, again, refer them back to their physio, just in case there's an underlying issue there. Okay, so and then once they're able to get back into their normal program, that would be a good thing. Okay, so a knee injury would be our condition for the last point that I'm going to talk about. So the client has injured her knee at netball training. She's been advised it's a mild grade 1 sprain. Okay, so most of your grade 1 sprains, recovery time is generally anywhere from that 1 to 2 week time frame. So the type of injury can occur when your ligaments actually stretch. So the joint may be hurt, there could be some slight swelling, not always with a grade 1 sprain. Sometimes there's no swelling and the client may have next to no pain, but they may just feel a little bit of a twig when they're running. So generally with conditions like that, we'd just be looking at reducing the exercise and the amount of pressure that they're actually loading if there's any weights there. With the cardio, I'd probably try and take the cardio out of it a little bit, get them on a bike, so reduce any running, probably no rowing, so really just take them back to the bike so that they're off their feet. If there's slight pain with that range of motion again, we may need to monitor their seat level so that the leg is actually going longer as well. So restrict the weight or perhaps make the weight lighter for that period of time. As I said, reduce the running. Again, aqua aerobics, really big on that. It's going to take them back to a free loaded weight, and they'll be able to move through the water nice and easy with that as well. Exercises that are required, perhaps maybe just take the lower body out, sit your client down and look at the exercises that we can actually do for our upper body, our core strength. Okay, so our obliques, our triceps, deltoids. There's a lot of muscle groups up the top that we can actually work while we give that knee a bit of a rest for a little bit of time. Depending on the symptoms and the severity of the injury, again, monitor as needed. There could be an underlying issue, so if it does persist, just speak to your client and refer them back to their physio or their doctor, and monitor as needed. Okay, thank you.